Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Speckle report. This audio podcast is part of a Heighe Bedlam. This audio podcast as part of a Bedlam Plexar, and this audio podcast as part of a Storm Robotics production. This audio podcast will go over sort of healthcare education in context of this peer-reviewed published works from 2021. CKD or chronic kidney disease complications can stem from a variety of comorbidities and become multisystemic, for example, causing scarring and narrowing of the urinary tract. CKD patients are also routinely undertake sort of routine investigations such as laboratory investigations. CKD healthcare service users are prescribed several can be prescribed several medications or regimens throughout the disease pathway pre and post transplantation. So CKD healthcare service users are being prompted or have been prompted to have been prompted to sort of to take a lead in aspects of service healthcare service provision. And so little is known about sort of patients or healthcare service users understanding of tests and investigations test and investigations received through electronic patient records, for example. And having access to healthcare records may not guarantee that healthcare service users, for example, will know how to contextualize information. So patients want a sort of greater availability of face-to-face support to understand test results, for example, or at least have healthcare professionals sort of be part of online support group discussions where they can get more healthcare. By improving patients' understanding and education of condition. This would also reduce inequity of care and improve the health of the CKD population. And whilst providing patients with access to laboratory tests through electronic patient records is advantage as it is advantageous. It is insufficient to fully meet sort of healthcare service users' requirements, especially if they are being driven to self-care or prompted to self-care and do not have full understanding of health and results required to do so. So to facilitate the interplay, patients, healthcare service users, or patients should be supported to interpret and manage sort of investigations. So patients and healthcare professionals or healthcare service users and healthcare service providers should be involved in online consultations to encourage shared decision making. Electronic patient records should also be updated with smarter infrastructure to support the self-management and education of healthcare service users. Um, the developments in patient in service and healthcare service users or patient care delivered through online portals and how healthcare is delivered to patients should encourage updates across several levels of healthcare. Support for healthcare service users with long-term conditions from healthcare professionals can be delivered in a variety of online and in-person sort of sessions, as well as involving numerous practitioners. Patients or healthcare service users would perhaps find it more advantageous to schedule online consultation with healthcare professionals who can provide remote educational services. Educated healthcare service users become a bit more empowered, and can make informed decisions surrounding treatment, around choices, the varying choices in amongst healthcare service provision, if for example, again, where they have access, or where they can have access to varying members of the MDT, or multidisciplinary team. That draws this audio podcast to a close. This audio podcast as part of a Speckle report, this audio podcast as part of a Heighe Bedlam, and this audio podcast as part of a Bedlam Plexar, and this audio podcast as part of a Storm Robotics production.